Hey guys, we're going to talk about non-fluent aphasias in this video. If you haven't watched my fluent aphasias video, make sure to watch that because there's a little bit extra explanation at the beginning. But we'll just jump right into it here. So just as a reminder, Broca's area is here in the orange. Wernicke's area we'll put as a W here. And then this is anterior, so A and B are next to each other, and then this is posterior. That can help you remember which one's anterior, which one's posterior of the Broca and Wernicke's areas. So let's get into these non-fluent aphasias. So if you don't have fluent speech, the thing that you probably are most commonly going to hear is broken speech Broca's. So they can't say words very well. They have a lot of difficulty getting out a sentence. Sometimes it's only one word and that's the only word that they can say, and they have difficulty saying anything else. Looks a little bit different depending on what kind of stroke they have, but in general, broken speech, and it'll be very clear on the exam question that they're testing. So with Broca's aphasia, what they're doing is taking out somewhere in this Broca's region. Like we talked about in the last video, in order to be able to repeat things, you need to be able to have both Broca's and Wernicke's areas intact, because you need to be able to comprehend the word that you're supposed to repeat, and you're supposed to be able to say the word that you're supposed to repeat. So your language needs to be fluent. So you are not fluent and you cannot repeat because that Broca's area is taken out. You can comprehend. So this is extremely frustrating for patients because they know what's going on. They just can't, they can't say out loud what they're feeling. It can be extremely, extremely frustrating. So the next one we'll go to a little less common, but if you break down the words, pretty easy. So like we talked about in the last video, transcortical motor. So if we're thinking cortical, cortex, so a little bit higher in the sketch, like with Wernicke's area, Broca has little signals that go out here to the brainstem, or excuse me, away from the brainstem, and that is higher process functioning. That's what's able to actually complete the process of forming words. And so you can also get lesions out here. So they affect the signals coming from Broca's area, but not Broca's area itself. The reason that's important and the reason why it's different than Broca's is because you're still not fluent, because this fluency area is affected, but you can repeat because Broca's area itself is intact and Wernicke's area itself is intact. And so once again, make sure you ask about repetition, have them repeat a word and repeat a sentence to see if they have that intact, because that is the only difference between Broca's and transcortical. Now, mixed transcortical is going to be a mix between transcortical motor and transcortical sensory. So it's mixed and transcortical. So cortical, cortex. So it's going to be both motor and sensory. So we're going to put motor up here. So that looks the exact same as transcortical motor. If you watch the other video, you know these projections that go out here equal transcortical sensory. But when you have a mixed picture, those are affected too. So this can be very difficult. Usually these patients don't have a lot of speech at all because they're not fluent and they can't comprehend. But the thing that's most important, and the thing that will differentiate this from a global aphasia that we'll talk about next, is repetition is still intact. So these fibers from Wernicke's and Broca's areas that are going up to the cortex are affected, but those areas themselves are not affected. So this is still intact. So that's really important to remember that. And global is, basically what it sounds like. All the areas are taken out. So all of this is taken out, repetition's taken out, comprehension's taken out. They really have no speech whatsoever. So the only difference between mixed transcortical and global is that with global, they can repeat. So if they're not saying many words at all, still try to get them to repeat something, because you could detect a mixed transcortical picture. So I know that was a lot of information. If you take anything from these videos, know that broken speech, Broca's, you are not fluent and you cannot repeat. And Wernicke's word salad, You cannot comprehend people, people cannot comprehend you, and you cannot repeat. Just think about this diagram, picture it in your head, watch these videos a couple times, and you'll be able to nail it on test day. Good luck.